Henry, thank you so much for joining me. We actually know each other through working with other platforms that we're both sort of connected with. But thanks for joining me today for my own channel. The reason why I wanted to talk to you is a male perspective. I think it's really easy when you're in like the women's health sort of world to like directly straight to females, but I know that your partner also has endo, so that I'm really keen to sort of touch on like what that's like from like a partner's perspective as well. And of course, you are a doctor, but not just a doctor, saying quotation marks. You also have loads of research in social prescribing, which I'm really interested in, because I think anyone with sort of any health condition, especially females with hormone health, a lot of it comes down to sort of their lifestyle as well. And social prescribing comes into that, doesn't it? So, yeah, thank you so much for joining me. Have I introed you enough? Is there anything else I've missed?
No, I think that's all good.
Yeah. Okay. Right. Well, we'll kick off then, because I saw on your Instagram a video that actually did perform very well, didn't it? That said that you left medical school. Can you tell us a little bit about that?
Yeah, so about 4 years into medical school, so we'd done how medical school tends to be split up in a traditional way is 3 years or 2 years preclinical and then 3 years clinical. So the preclinical years, you're studying physiology, anatomy, pharmacology. It's quite theoretical. And then the final 3 years are in hospitals and general practice, and you're kind of getting more stuck in. And I'd done a year of clinical medicine when I'd left, when I decided to leave. So, but within that clinical year, I think very quickly saw within hospitals that we were not really able to support patients with the kind of root cause of what was going on with them a lot of the time. We were kind of very good at dealing with the biomedical problems within hospitals, and even within general practice as well. You know, you'd get into trouble almost if you didn't catch something medical, but if something psychological or social was sort of missed or not supported with, then it was kind of less important in a way.
Okay.
And we kind of saw the same patients coming back to A&E time and time again. It kind of felt like we were patching up patients' biomedical problems that were often rooted in their social circumstances in some way, and then kind of sending them out into the community where they became unwell, and then they come back, and it was kind of this like revolving door. That's not all health, obviously. I know you work in the kind of hormonal health space, and there are so many examples where, you know, biomedical health problems are not caused from psychological and social circumstances, but a lot of them are. A lot of them are to do with health behaviors or lifestyle in some way. And I just felt like we were not dealing with those issues very well as doctors. And so I was kind of looking at other ways I could support with those things, and eventually applied for some funding to do a PhD in an area called social prescribing, which is looking at how community groups and activities can support people's mental and physical health. Often people with anxiety, depression, loneliness, but also chronic health conditions. And so I got some funding to take 3 years out of medical school, basically, to do some research at UCL on social prescribing. And then they let me come back to medical school to finish medical school off after about 3 years out, which was a difficult
Is that where you're in
return.
now? Are you back at med school now?
No, I finished medical school, and yeah, I've been a junior doctor for a year and a half or so, and also doing some research as well at the moment.
Oh, wow. Busy. So it's interesting that, you know, you touched on, you know, a lot of hormonal problems are like medic based, right? But often, often our hormonal issues can be caused by lifestyle, right? And that was my experience with the GP, is the GP missed the lifestyle aspect of
Mm,
me. They looked at, okay, you're not having a period.
mm,
Um, let's see what's going on medically, when actually what was going on medically was that my lifestyle wasn't in alignment with my body. And I think that's often
mm.
like, I feel like GPs are very easy to sort of dish out sort of antidepressants and anxiety meds and things like that. Whereas instead of just looking at their lifestyle first, right?
Mm. Yeah, I'm curious as well for you as well. What were the kind of main lifestyle
Um,
things for you that you felt were
over
kind of
exercise,
misaligned?
over exercising, under eating, stress, just stress on stress on stress, which just caused
Mm,
my period to disappear. So
yeah.
I went through like, and eventually I think I had to keep going back to the GP a fair few times, but eventually got referred. And all the scans and everyone was just like, yeah, you're not ovulating. Yeah, everything else is normal. And that was that. But because there
Mm,
wasn't like, I guess because there wasn't a tablet or like something to prescribe me to help me, they were just like,
mm.
don't really know. Whereas actually, if they'd dived in, I remember saying that I was actually applauded about how much exercise I do and how well I eat. But it was like, oh, if you had just dug a little bit deeper. But then I guess it's so difficult, isn't it? Like, what doctors have 10-minute appointments. They're not. They're GPs. If you see your GP, like they're not trained psychologists or understand every single area. Um, so it's so hard, isn't it? Because you can't expect someone to be an expert in absolutely everything.
No, I think that's true, and I think yeah, the 10-minute appointments are just ludicrous, really, to be able to get to the root cause of what's going on for someone. Obviously, if you have the same GP, you might be able to build that relationship, and um, that continuity of care is a bit more possible. But often, people don't get to see the same GP at the moment, depending on where your practice is. And I think we can do better in terms of training for medical students and GPs in terms of asking those kind of questions. And in this instance, being aware of um, elements of overexercising and disordered eating that maybe don't necessarily fit into a diagnosis, but are still something that should be kind of explored. And I think, yeah, lots of GPs do their absolute best to explore those things holistically. But I think, yeah, I mean, what chance do you have within 10 minutes when you have to, see the next patient after 10 minutes and you've got to ask a range of kind of questions anyway, like that you have to ask every patient. You have to get through this list of questions and make sure you're, managing risk appropriately and things like that. So it's pretty difficult. If you think about it, like a therapist has an hour to chat with someone to get to those kind of more root cause problems.
And even then, through therapy, right? It's not like that. It might take a few sessions to get to the root cause, not necessarily just an hour. Going back to your training as a doctor, then, how much training do doctors get around women's health, hormones, that kind of thing?
Hmm. Yeah, we do get a lot of training on it, on female health conditions, the reproductive cycle. I think the training is pretty good. I mean, it's not necessarily separated off as women's health necessarily, which is kind of an interesting thing in and of itself, because I think societally we often talk about women's health as though it's this kind of niche thing, even though it affects half the population.
Yeah, yeah, that's so true, isn't it? And it's like now that there's more studies being done on it, it feels you're so niche is such the right word. Is like it feels like we're like, oh look, woohoo, we're being heard, and it's like
Mm,
it's a bit like males with mental health. I think it's like,
mm.
oh, well done everyone, we're looking into this, and we're like, of course, like should we not?
Yeah, no, it's a weird one how the language is used in that way. I mean, I think kind of biologically and anatomically, pharmacologically, that kind of training is pretty good. I think where it's not so good is in, I mean, I think it wasn't very good in certain common conditions like endometriosis and sort of being aware of some of the atypical symptoms of endometriosis and just how common it was. I don't think that was really stressed enough in medical school. I think also kind of, and this is a problem with medicine in general, there's very poor training and very poor understanding on kind of autoimmune conditions, and we know autoimmune conditions tend to affect women more, and there are a whole host of conditions, whether that's chronic fatigue syndrome, Lyme disease, other autoimmune conditions that we have very poor understanding and training on, and that knocks down on our communication on with patients as well. And lots of patients have stories of being dismissed or told that there's nothing wrong with them just because what's wrong with them doesn't yet fit into a diagnostic test that we have available. And I think that's a major problem that I think is improving. But certainly when I went to medical school, the training on that was not particularly good. How do we kind of validate what's going on for someone and, validate that there is clearly something going on. They're not lying, just because we don't have a neat enough test yet to
Yeah.
test for it. I mean, even if you look at endometriosis, the majority of endometriosis, which is, probably the most common or second most common condition that affects women, most of that is not, doesn't come up on scans. So that's, a prime example, but it gets even worse when we think about conditions like, chronic fatigue syndrome, where the symptoms are very varied, they're quite hazy, it's very real, it has a huge impact on people's lives, but we're not really quite able to diagnose it, and we're not able to, treat it in a specific way either. And we don't really learn about the treatment pathways for chronic fatigue. So if you kind of have one of these autoimmune conditions that we don't really treat very well in the NHS, you often have to go to these,
Yeah.
private clinics, and some of them are probably excellent, but some of them are also, probably not so good and will take a lot of your money.
Yeah, definitely. And I think as well that whole sort of the NHS range when it comes to bloods, that like the classic, oh yeah, you're in normal range. And like, it's like, oh, that's not optimal, is it?
Mm. No, yeah, I think that is a tricky one. I think it's tricky because the NHS versus like private clinics will test you for a lot more things. And then, but there are reasons why, within the NHS, we don't test for absolutely everything. And there are kind of evidence-based reasons for that. And I do think that's also just like something to be aware of, that when you pay for lots of blood tests, privately, and maybe one's a little bit abnormal, and then people get upset that it wasn't tested for in the NHS. But often there are reasons why that's the case.
I think as
Um,
well is sort of there's an element of like appreciating the NHS, isn't there? Is like, of course there'll be faults within the NHS, but if you think like the amount, if you look, well, like zoom out and think about the amount that the NHS does, it just, I guess, I'm so appreciative of the NHS and doctors, and I think flipping out, I would not want your workload, put it that way. And the amount of training that you go through, and the long hours and all of that, I respect it so, so much. But then there's also like the other sort of side of it, that it feels like if you do have a hormonal problem, or you do, sorry, maybe like a more nuanced sort of, whether that's mental health or whether that's like a chronic condition or an autoimmune, it feels like if you're in a privileged position, you'll be okay because you might have the money to be able to go private, or you might be able to access the education, but it doesn't solve that sort of like issue of the underprivileged, if you like, that are struggling so much, and then that stops them going to work, and then that's such like a spiral for them as well, isn't it? So then they go in for like their 10-minute appointment, they get told they're fine, and they're like, well, I know I'm not fine, but they've got no other way to sort of solve that. I guess that goes on to, which then I guess can lead on to sort of mental health sort of issues as well, isn't it? If you're constantly told you're being fine, but actually you feel very much not fine, that can sort of spiral. And is that sort of the side of things that sort of inspired you to look at sort of social prescribing then?
yeah, I mean, firstly, just want to agree with all your points there. I think, it does create this two-tier system, even outside the NHS. Within the NHS, the care's, not there for a lot of those conditions. Unfortunately, the waiting times are too long. The treatment pathways just aren't there. And so obviously people go outside the NHS. But then it does create this two-tier system where certain people can afford, to see people privately, and others can't. Which is the whole point of the NHS and how it was set up. But unfortunately, we haven't quite nailed it for a lot of these, as you say, kind of hormonal conditions, a lot of women's health conditions, and a lot of autoimmune conditions, a lot of chronic pain conditions as well. There are a lot of things that we don't do, particularly well, I think, in the NHS in terms of waiting times, diagnosis, treatment pathways. And in terms of, motivating me to do research on social prescribing, yeah, it was definitely motivated by a social justice side, and that it was very clear that the people who were not getting better medically, kind of in hospitals and in general practice, traditionally, well, often were people who didn't have a support network around them, didn't have a social network, from lower socioeconomic groups, had addiction problems.
Mm.
Um, and so it's not a level playing field. And I think one thing that social prescribing aims to do is something what the researcher Michael Marmot calls proportionate universalism. So you roll out social prescribing for everyone, but it's more tailored towards people who need it the most. And certainly within my research, and I did some research with a football group that supported people with addiction problems, a community gardening group, a choir, and a reading group, all supporting people with mental health and psychosocial problems, often had chronic health conditions as well. They were all free, these groups. So they were all for people that wouldn't have otherwise been able to afford it, basically. So kind of saw firsthand that social prescribing can be used in that way, in a way that, providing it has appropriate funding, whether that's from third sector funding or local council or grants, can provide care for those that need it the most, and help to address those health inequities, basically.
And how do those organisations get the funding to be able to offer it for free?
It's hugely varied, but like they basically, most of them constantly have to fight for that funding, either from you know, large foundations, corporate funding, local council money. So a range of funding streams, basically. I mean,
Right.
ideally, you would have funding following referrals. So when social prescribing was increased within the NHS about 7 or 8 years ago, when several thousand link workers were hired by NHS England, and those are people who sit in between the GP and the community. So GP will refer a patient to a link worker who then sits with a patient for up to an hour, 5 or 6 times, and kind of co-produces a social prescription with them. Some of that might be helping them with their finances, but some of it might be referring them to a local community group, let's say a gardening group. Maybe the person said, "Oh, I quite like being in nature, but I don't have any friends or family locally. I'm a bit lonely. I smoke 40 a day. I've got hypertension. I've got diabetes. I'm not very happy at the moment." And so the social prescriber can recommend, given that person is struggling with these things, and they mentioned that they enjoyed getting out into nature. There's a local gardening group that you can go and volunteer at, and they offer free tea and biscuits and whatever, and then see if that person wants to go along to that. So yeah, that's kind of the idea behind social prescribing. Really, it's for people with anywhere from moderate to severe mental health problems, often chronic conditions as well, where there's like a behavioral component. So I spoke to a lot of people who had addiction problems, but then from like regular engagement with, say, a football group or a gardening group, they were able to kick their addiction because they'd replaced, one unhealthy habit with a healthy habit.
And I think, like, even when we look at addiction across the board, right? Like, I know when we talk about addiction, we automatically think sort of gambling, alcohol, drugs, that kind of thing. But
Yeah.
I even see that with like some of the girls that I talk to, that maybe it's low level addiction. So, but there's definitely maybe a form of like obsession when it comes to like tracking calories or their steps and things. And what I've also found talking to them is, you give them a different focus. And often the reason why we were obsessed with steps or calories or whatever it was that sort of we're hyperfixated on is because we're trying to fill a void. So
Yeah.
if you can fill that void with something else, it's an absolute game changer, isn't it, for people?
Yeah, absolutely. And there's that quote around addiction, how the opposite of addiction is kind of connection as well. And it's kind of connection to ourself and our true self, but also connection to others as well. And I do think social prescribing, which effectively is just engagement with community, but healthy community, is a real antidote for addiction for a lot of people, whatever addiction means. And as you say, it comes in so many different forms.
Yeah. I love what you mentioned there about like the connection to yourself, because I often think with so many medical conditions, whether that's hormonal, sort of autoimmune, like I've got an underactive thyroid,
Mm,
that's still very much, I believe, a disconnection from self, right?
mm,
I I had a baby, which I know is very common postpartum, but I just went for it. I was
mm.
back running, doesn't matter how much sleep I had, I was running, I didn't take maternity leave, I was constantly going. And that was lack of connection to myself. And I know you're big in sort of mental health and those sort of, is it like, would you describe them as like holistic therapies in terms of like journaling and meditating? But all of those things that you seem to prescribe slash talk about is always coming back to self, isn't it, really?
Definitely. I think it's that thing of coming home almost, and coming home to your body. And I think we're so disconnected from our bodies, aren't we? A lot of the
It's
time.
like we don't trust them.
Yeah, I think also we've got this split of mental and physical health, don't we? And how we talk about it. And the scientific reality is that they're not split in any way whatsoever. Whatsoever. You know, they're entirely intrinsically linked for a whole host of biological, psychological, neurobiological mechanisms. But we kind of talk about them a bit differently, and I think that means it's common to have this disconnection from our body. Maybe we're better at talking about things now. But in terms of listening to our body, what does that even mean? And actually, it's quite
Yeah.
hard if you're not kind of trained in that or used to that. And it's a gradual process and journey that I'm sure you've gone through of really slowing down. Actually, because I think when we're fast paced all the time, we're working really hard. Maybe we're exercising really hard. Whatever it is, we're go go go. We're in fight or flight mode the whole time. Um, we're running from something in a sense, and often that's running from ourselves and our bodies, and our bodies saying, you know, no, we need to slow down, and that's hard. It's hard in the,
Yeah,
the culture that we live in.
I would say it was only when I slowed down. So they say when you have a baby, your brain chemistry changes.
Mm.
And I was like, meh, shut up. That don't actually happen. So many people told me oh, you think you're going to still work when you have a baby? I was like, meh, I'll show you. So I fully went for it.
Mm.
He's now 2 years old. And I finally slowed down this year after being diagnosed with an underactive thyroid. Went
Mm.
on medication, finally slowed down. My brain chemistry's changed.
Mm.
Like, I'm fully, but I think, like you were saying there, is that slowing down, isn't it? It's like as soon as you slow down, you start to be able to listen more. And I mean, so what, we're April. So it's taken me 4 months. It still feels odd when
Mm.
I say no to work things, or whether I, I'm, I have no real interest in things that used to interest me so much. I'm still getting used to that. But it is that as soon as I slowed down, I could hear more. And
Mm.
whereas you think, "Oh, no, keep doing, keep doing, keep doing," and it's weird because there's no voice, is there? It is such a slow, gradual journey where, yeah, if you do slow down, you can listen a little bit more, but you will never know that until you do slow down. And
Yeah.
then even then, when it comes to slowing down, what are some of the tools you would recommend to help people come back to their bodies?
Mm. That's a great question. And yeah, that's great to hear about your journey in that regard as well. And
It's scary though to slow down. It's so
yeah,
scary because you're like, "Who is this person? Like,
yeah,
why does this mean I'm lazy? Does this mean I'm not
yeah,
driven anymore? Does this mean I don't care about things anymore? Does this
yeah.
mean I won't earn any money anymore?"
Mm. But it's growth, isn't it? But it is shifting identity, I think, and that's really hard. It's always hard, especially, when an element of your identity, or at least how you perceive your identity, is to do with productivity. Maybe it's to do in some ways with exercise or your body, which is common for women. And I think, um, yeah, that shifting identity is always going to be really, really hard. But it's also growth.
Do you
And
find that with people with addictions as well, that like that whole sort of like shift in identity is the hard thing? So they
yeah.
want to change, but the shift in the identity is the thing that's sort of holding them back.
Mm, yeah. And also, I think it's that being with yourself thing, isn't it? I think with addiction, and you can be addicted to work. People can be
Yeah.
addicted to work and all sorts of things. So
I
it's
think if
this.
I look back at my like sort of previous patterns, it was addicted to fitness, addicted to sort of like lower, like focusing on my steps and my food. Then
Yeah,
it shifted into being addicted to work. And then it was only after I had a baby that it sort of forced me to be like, oh yeah, I've actually got to slow
yeah.
down. I chose not to slow down, got my underactive thyroid. And then suddenly like that medical thing is just like, well, no, you've got to now. And it's
Mm,
only then that you're like, oh, this is who I am.
yeah. Well, the body's very smart, isn't it? Um, and I think eventually it's going to be knocking at the door and telling you what you need to do. Um, and I think a lot of it is around being like with yourself as you are, and
Mm.
feeling that that's enough, and that's hard for a lot of us. It's why we're addicted to things, and we work too hard, and we have our identity based on our productivity. And similar with addiction, the root of any addiction is I don't feel enough as I am. I need to do this thing, ingest this thing, over and over again to feel differently to how I am right now. So I think it's coming back to your question around techniques and practices. I think meditation and mindfulness for me is at the top. I think it can feel inaccessible for some people who haven't tried it that much, or maybe they've tried it once and have felt it wasn't for them. There's a great intro book which I'd recommend called Finding Peace in a Frantic World, which is an evidence-based mindfulness book that you can work through by a guy called Mark Williams, who was one of the people who brought over mindfulness to the UK. It's why we have it on the NHS. So it's a very good book. It's recommended by GPs. If you don't meditate, that would be a good place to start, I would say. So it's called Finding Peace in a Frantic World. And then there are lots of apps that you can use as guided ones. So Calm, Headspace. There's an app called Waking Up that I really like. Um, so I think that's the reason why that's important is that we can kind of catch our thoughts before we maybe engage in an addictive behavior. And we can sit with our thoughts and realize that they don't harm us. They are just thoughts. They will come and go. And that might sound really simple. But actually, I think it's quite profound. And I think the more you do that repeatedly, the more you really do create this relationship with your thoughts where you're kind of separate from them, and you realize that you're kind of the observer of the thoughts rather than the thoughts themselves. And I think that can help a lot with addiction. It can help a lot with feelings of shame, feelings of kind of not enoughness. So I think if you feel you can develop a kind of meditation or mindfulness practice, I think that would be super valuable. In terms of in the moment kind of practices, breath work can be really helpful. Even just very simple things like slowing down your breathing and having a longer out breath to help activate your parasympathetic nervous system and help relax you. Um, yeah, I mean, journaling, I've talked about before, I think just can be really helpful to get your thoughts out on paper. We're not very good at logically thinking within our own brain in a stepwise way. Our brains aren't really designed for that. So we'll just go round and round and round and round and round. That's why talking to someone helps, but it's the same with journaling as well. You can kind of, give therapy to yourself. You can write down a thought that you're struggling with, and then you can kind of reply with a counter thought. So maybe you're having a thought that you're going to this social event and you're worried that people don't like you there or something, or you're not going to be interesting or whatever. And then you can write that down that you are having that thought. So there's a technique within acceptance and commitment therapy called thought diffusion. So you don't say, you know, I'm unlikable, people don't like me. You say, I am having the thought that, just
Okay.
to help kind of create that separation. And then a journaling practice that I like is kind of writing that down and then writing down a kind of counter thought or a more logical thought. Um, it sort of makes sense when you write it down. When you're trying to do it all in your head, I think it can be quite hard.
Yeah, there's so many, you can spiral quite quickly, can't you? I
Sure.
love that. I love the whole detachment of it. It will definitely help with a lot of people that sort of watch this, that in the
Do,
sense of
do, you,
like,
do you meditate at all, or I'm not? I'm just curious. Right, I'm
I
not trying to.
you know, I I love it.
Yeah.
I'm just not good at prioritizing it.
Yeah.
When I
I get
do
that.
prioritize it, I complete life changing. So
Yeah.
I worked with a hypnotherapist who developed
Okay.
hypnotherapy for me, and I did that every single day,
Mm,
completely life changing.
mm.
Um, and it's when it's like one of those things that you're like, pick that up again, pick that up again. In fact, that's a question for you.
Mm.
Someone that would like to maybe pick up meditation or to dabble into, or maybe they have done before, but they drop off. How do you create that sort of consistent practice?
I think this is the question, isn't it? And it's something I've always struggled with. I sort of cheat. It's not quite cheating, but what I did recently to help me with this was post about it on social media a couple of months ago. And I said, I'm going to do this every day now. Um, can you help hold me to account as an audience? I mean, no one needed to do anything. It was really
Yeah,
just
yeah.
I didn't want to let people down, even though no one would have been let down and probably nobody cared. It's the idea of the spotlight effect, right? That we
I
think,
guess it's putting it out there, isn't it?
yeah, but it's creating some kind of accountability mechanism. So you could do it with a partner, you could do it with a close friend, you could do it with a therapist, a GP. Like, it doesn't really matter. Like, someone who you feel, you say to them, listen, I want to try and meditate once a morning for 5 minutes for a week. Don't be like forever, because you're not going to stick to that. Just see if you can do it for a few days, then see if you can do it for a week, then see if you can do it for a couple of weeks. Amazing. And also, don't beat yourself up if you miss a day, because that also puts a lot of pressure on yourself. But I do think, for me personally, like when I'm trying to create a habit, like an individual habit, group habits are easier because you just meet up with the group and you're going to do the thing. Individual habits are harder,
Yeah.
but I still think humans are we're wired to, we're wired for social connection, and we're wired to not want to let other people down or think that we're letting other people down. So if you can create some kind of buddy system or accountability for yourself, I think that can be really helpful. And
It's
then also,
literally why I do that. Sorry to jump in. It's
no,
literally why I do that, my level of coaching. So
yeah,
I'm not a doctor, I'm not medical, but what I found when I was trying to recover and get my period back was that the lack of accountability. It was all down to me to recover. It was all
definitely,
down to me to make sure I was eating enough, and that's hard to change that habit. So that's
100%.
literally exactly why I do what I do. Sorry, you said about a second thing before I interrupted you. Sorry.
No, no, no. I mean, I yeah, agree with all of that. I don't know if this is a phrase that exists, but I like thinking about this idea of social habits. So rather, I think often habits are very individualized, and even most habit literature is very individualized. But actually, I think if we thought more around how we're social beings, we're social creatures, and the most effective way of getting someone to do something or increasing motivation is to introduce that kind of social connection in some way. Uh, yeah. So I think second component, I guess, in regards to meditation, but also any habit, is thinking about your like identity. So there's a lot of evidence that if a habit becomes part of your identity, you're more likely to regularly engage in it, and it's much more likely that a habit will stick. So, for example, with running, it might be, you're telling people that you're a runner, rather than just like, oh, I don't really like running, I'm trying to do a bit more, that type of thing. Again, sounds simple, but can be quite effective. I also think another thing that's helped me is because fundamentally we're always trying to come up with these tricks with habits, and that's fine. That's helpful because individual habits are hard. But I think the reality is it's always going to be hard, and so there's always going to be a degree of willpower. And so I think thinking about, certainly in regards to meditation, thinking about it in a positive way rather than a negative way. And by that, I mean, not thinking like I should be doing this and, beating yourself up if you're not, doing enough meditation, but actually really thinking, if you've done a week or two and it's helpful, thinking, wow, this has a profound impact on my life. It gives me so much. I want to make the most of my days. I want to be the best version of myself with other people. I don't want to respond reactively. I want to start my days in the best way. I've got this one little tool I can do, 5 minutes in the morning. It's actually pretty easy. I know it's really effective for me. Bringing that kind of positive energy to it. So I think thinking, yeah, accountability, identity,
Right.
and positive.
Just on the identity thing, Does anyone else though just like as soon as they'll do something because it's going to help them, and then as soon as they start feeling good, they sack it off because they're like, well, there we go, I feel amazing. It feels
Definitely.
like there's such a pattern, isn't there, of like picking something up when you feel like crap and then sacking it off when you feel good because you're like, well, here I am. But
I
I've
think 100%.
there was a quote in one of Tony Robbins' books that I love so much. It's imprinted in my head. You know, just one of those quotes that always comes back.
Mm.
It's not even a quote; it's theory. It's the pain and pleasure theory.
Yeah,
So
yeah.
I don't know who developed it, but it was just in one of his books that said, for you to be able to change something, the pleasure has to be greater than the pain, or the pain has to be greater than the current pleasure. So, for
Mm.
example, are if you're wanting to develop a meditation practice, or you want to stick to sort of I don't know, let's go with meditation. So you want to stick to a meditation practice. The pleasure that you gain, or the potential pleasure that you will gain from that, has to be bigger than the pain that you experience when you're currently practicing. Or
Yeah.
likewise, your current pain situation like how bad you feel now has to be bigger than the pleasure of not doing it,
Mm.
which is great. I think I absolutely love it. But so the whole pain pleasure theory, and that, okay, but then how do I keep telling myself
Mm.
that this is going to be better for me? Because then I feel like that's a whole different, so you can develop the habit, but then you feel good and then you sack it off. And then it's like, but how do I know that it's going to benefit me?
Yeah. It's a good question. And I think it's an interesting theory. And I think, yeah, there's evolutionary and psychological evidence for that. Humans
Yeah.
are wired to avoid pain and move towards pleasure and positive feelings. And the pain and pleasure centers in the brain are located in the same areas as well. I think that doesn't necessarily mean you're always going to do it. I mean, I think if you were to have like a cold plunge at a sauna, I would always know that does make me feel better, but it doesn't even swim in a cold sea. It doesn't necessarily mean you're always going to do it. Because I think we also have the negativity bias, don't we, where we focus on the negatives kind of more. I think with meditation, I think I understand that pattern. I've definitely succumbed to that as well many times, in terms of picking it up when you're not feeling great and then dropping it when you're feeling better because you're like, what am I doing? Like, why do I need this thing where I just go sit, for 5 minutes and like breathe and like focus on my breath? Like I could be doing other things, but that's the point, right?
Yeah.
That is your productivity brain going, you shouldn't be doing this thing because you're not doing anything. You feel great already. Like, why do I need this? And I think when that voice comes in and says you should stop doing it, I think is the time where it would be good to see if you could just try continue it a bit more. Because I think for me I've only been doing like daily meditation for like a couple months now. And before then, it's very sporadic. I'll often go through weeks of meditating every day. And then, months of not really meditating much. Trying to do it every day at the moment, every morning as a kind of ritual. I think the most important thing for me is that I'm allowed that 5 or 10 minutes to meditate, to just be with myself, to be with my breath, to be with my body, to be with my thoughts, to not do anything. Because for me personally, probably similar to you, work very hard, do a lot of things, a lot of hobbies, very productive. A lot of my identity has come from that to a degree, or I felt it's come from that. And so meditation will always have a benefit for me, I think, even if I can't like actively see it every day, because of the message it tells me every single day that actually all you need to be is be. You don't need to do. None of us need to do. We can just be human beings rather than human doings a bit more. So I think coming back to that time and time again, the why, like why are you doing this? Because you won't always see, as you say, you might notice the benefits after a few weeks and then you're kind of fine and you're like, why am I doing this thing? this weird, where I just sit. But that is the point. Does that make sense?
Yeah, yeah,
Cool.
yeah, yeah, yeah. Yeah, it definitely makes sense. I think I love that idea of when you hear the voice that says don't bother doing it, that's actually the voice that tells you to do it. Um, that that's quite cool to sort of like reframe it, I guess. Um, Henry, thank you so much. It's been so, I love how this conversation has sort of pivoted more onto like habits. I know you're really into habits anyway. Um, yeah, I just think it's so interesting to see your journey into social prescribing and how actually this is all sort of connected. I feel like I could talk to you for hours, but I promise I
Ah,
won't.
you too.
I'll let you crack on with your day. So if anyone wanted to sort of tap into like you a little bit more, where can they do that?
Yeah, so I've got Instagram account, which is Dr. Mental Health, and then I've got a website as well, which is Dr. I think Dr. and then Henry Aughterson .com. It's my surname is spelt daughter son without the D.
Ah, so it is.
Yeah, and if anyone wants to reach out about anything, then please do.
Yeah, brilliant. And I'm loving sort of your Instagram posts around, you do a lot of sort of like journaling if you're feeling, one of my favorite videos was that the one you did around like uncertainty. I think
Mm,
it's really cool that when you tap into sort of certain feelings that you're like, oh yeah, uncertain. We always talk about sort of depression and anxiety, don't we? But you forget about, I guess, like the little feelings of like uncertainty. So I think they're
yeah,
really cool. And yeah, obsessed with your research. I'm sure we will stay in touch about it. I'd love to hear more about what you're doing. So thank you so much for joining us. And I shall see you soon.
thanks very
Bye.